Has someone you love begun to show subtle but troubling changes in the past year? While many people believe that death in old age comes suddenly, the reality is that the body often sends silent signals months and sometimes even a year before life reaches its final stage. The challenge is that most people miss these signs at first because they seem insignificant. It is only in hindsight that families realize the signs were there all along. But by then the opportunity to prepare and make those final memories truly count has often passed. In this video, we will discuss 5 key indicators that often manifest themselves in the year leading up to a senior's death. Some of these may be changes you have already observed but dismissed as simply part of the aging process. Others may seem like minor changes, but they actually signal the body's gradual decline. Recognizing these signs early provides you with the invaluable opportunity to provide enhanced care, cherish meaningful moments and, most importantly, ensure that your loved one's final chapter of life is one of comfort, dignity and peace. Please stay with us until the end, as these 5 indicators can greatly assist in your emotional and practical preparation for what lies ahead. When you have an understanding of what is happening, you will not be surprised. Instead, you will be empowered to make the most of the precious time remaining with those you love. Let's start with the first sign: significant weight loss. One of the earliest and most telling indicators that a person may be approaching the last year of life is unintentional weight loss. At first, it may be subtle: a belt that suddenly requires a tighter notch, clothes that seem to hang looser, or once robust appetite that begins to diminish. Many families attribute this to the natural process of aging, but the truth is that weight loss without active effort is rarely a positive sign. It often indicates that the body is no longer absorbing nutrients efficiently, muscle mass is decreasing, and essential bodily systems are beginning to slow down. While aging naturally leads to some muscle loss, when it occurs too rapidly, it signals a deeper underlying process. The body may be struggling to properly digest food, or the individual may no longer be able to effectively process protein, leading to muscle wasting. This loss of strength not only makes movement more difficult, but also increases the risk of falls, weakens the immune system, and makes the person more susceptible to infection. Another major contributor to weight loss in the last year of life is a change in appetite. Many older people simply do not experience hunger the way they once did. Their sense of taste may fade, food may no longer seem enjoyable, and they may begin to skip meals or eat significantly smaller portions. This is not just a matter of personal preference, it is a physiological change. The body, sensing its impending shutdown, no longer signals the brain to seek food as frequently. The resulting consequences are reduced energy levels, decreased strength, and a gradual decline in overall health. In addition, underlying medical conditions play a critical role. Weight loss is a common symptom of chronic diseases such as cancer, congestive heart failure, or kidney disease, all of which can begin to progress long before more overt symptoms become apparent. Conditions such as depression or cognitive decline can also lead to reduced food intake, creating a downward spiral in which the body lacks the necessary fuel to sustain itself. Some families try to address this issue by encouraging their loved one to eat more, offering favorite foods, or supplementing meals with protein shakes. However, if the weight continues to drop despite these efforts, it is important to recognize that the problem goes beyond diet. It means that the body is preparing for a deeper transition. At this stage, forcing large meals may not be beneficial. Instead, prioritizing comfort, easily digestible options, and adequate hydration may make a more significant difference in maintaining quality of life. If you notice significant weight loss in an elderly loved one, especially if they are eating less, feeling weaker, or struggling to stay active, it is important to pay close attention. This is not just about physical appearance, the body is sending a message. Understanding that message now can empower you to navigate the journey ahead with clarity, compassion, and the ability to make every remaining moment truly meaningful. One of the most noticeable changes in the year leading up to the end of life is a profound, persistent fatigue that is not alleviated by rest. This is not just feeling a little tired after a long day. It is a deep exhaustion that makes even the simplest tasks seem overwhelmingly difficult. Getting out of bed becomes a significant challenge. Walking across the room requires considerable effort. and activities that were once routine, such as cooking, dressing, or even holding a conversation, begin to feel too draining. This is not just a consequence of aging, it is a sign that the body is actively conserving its remaining energy reserves. As organ function begins to slow, the body begins to prioritize the most essential functions. The heart does not pump blood as efficiently, circulation weakens, and muscles do not receive as much oxygen as they once did. As a result, many older adults in their final months experience a pervasive sense of weakness, unsteadiness, and an inability to maintain the same level of activity they once enjoyed. Another major contributing factor is a slowing of the metabolism. The body is designed to produce and use energy, but as it prepares for its final phase, that energy is redirected. Instead of fueling movement and activity, the body shifts its focus to maintenance. This explains why someone in decline may begin to sleep more frequently, require longer naps during the day, and find it increasingly difficult to stay awake for long periods of time. Some people may even experience sudden and unpredictable drops in energy levels, feeling relatively well one moment and completely drained the next. Perhaps the most heartbreaking aspect of this process, however, is the emotional impact of this profound fatigue. Many seniors, who once took immense pride in their independence, begin to feel frustrated or even embarrassed by their inability to perform tasks they once accomplished with ease. They may withdraw from conversations, avoid social interactions, or give up cherished hobbies not out of a lack of interest, but simply because they lacked energy. Unfortunately, this can lead to a cycle of isolation where they stop trying altogether, which only serves to accelerate their overall decline. For families, watching a loved one go from active and engaged to exhausted and withdrawn can be deeply painful. It is easy to mistakenly assume that they are simply lazy or that they need to try harder. However, the reality is that forcing activity will not be beneficial. What really matters at this time is understanding their limitations, allowing them to rest when needed, and making sure their remaining days are as comfortable and peaceful as possible. If you observe a loved one experiencing deep, persistent fatigue that is not relieved by rest, recognize it as an important sign that their body is undergoing a major transition. This is a precious time to treasure quiet conversations, create moments of peace, and offer unwavering support without expecting them to maintain their previous level of activity. At the end of the day, what really matters is not how much they can do, but that they feel loved, understood, and completely comfortable. If you are still watching this video and find these insights valuable, please acknowledge your presence by commenting number 2 below. And if you haven't already subscribed, I highly recommend doing so and turning on the notification bell so you don't miss future videos. Your support allows us to continue to create helpful content to inform and inspire you. Now, let's move on to the third sign: increased cognitive confusion or withdrawal. As a person approaches the end of life, one of the most noticeable changes is in their cognitive processes, ability to communicate, and interactions with others. You may notice that someone who was once mentally sharp and actively engaged begins to experience more frequent forgetfulness, struggles to follow the thread of conversation, or seems disoriented even in familiar surroundings. They may repeat themselves, forget the names of loved ones, or lose track of time, even if they never had significant memory problems before. These subtle cognitive changes can manifest months or even a full year before death. This is more than the everyday forgetfulness associated with typical aging. The brain, like every other organ in the body, needs a steady and adequate supply of oxygen and nutrients to function optimally. However, as circulation weakens and oxygen to the brain diminishes, cognitive function inevitably begins to decline. The person may become easily confused, have increasing difficulty making decisions, or have trouble recognizing people and places they have known intimately for years. In some cases, they may even experience brief periods of mental clarity followed by sudden episodes of confusion, almost as if their mind is intermittently fading in and out. Another common and significant sign is emotional withdrawal. Someone nearing the end of life often loses interest in social interactions and activities they once enjoyed. You may notice them speaking less frequently, participating less in conversations, or simply sitting in silence for long periods of time, seemingly lost in their own thoughts. It is important to understand that this is not necessarily due to a lack of affection for their loved ones. Rather, their brains are not processing emotions and the desire for engagement in the same way they once did. Conversations can become tiring and overwhelming, noisy or stimulating environments can be distressing, and eventually many seniors tend to retreat into their own inner world. You may also notice changes in their mood and behavior. Some people may become more irritable, experience increased anxiety, or become easily frustrated by small things. Others may seem unusually calm, emotionally detached, or indifferent to matters that were once of great importance to them. This is not simply a change in personality. It is often a direct result of the brain's attempt to adapt to the body's overall decline. As cognitive function slows, the ability to express emotions effectively becomes more difficult, and the person may no longer respond to situations in the familiar ways they once did. For family members, this stage can be especially emotionally difficult. Watching a loved one gradually lose touch with reality or withdraw emotionally can feel like a profound loss, as if they are slipping away even before their physical passing. However, it is important to remember that this is not something you can consciously control. Rather than persistently trying to draw them back into conversation or force engagement, the most compassionate approach is often to meet them where they are. Speak gently, offer consistent reassurance of your love and presence, and understand that even if they do not always respond verbally, they can often sense and appreciate your quiet presence and comforting touch. If a loved one exhibits increasing forgetfulness, greater confusion, or a noticeable withdrawal from social interaction, please do not ignore these changes. These are often early indicators that the body and mind are preparing for the final transition. This is a time that requires immense patience, the appreciation of quiet moments together, and a focused effort to create an environment that feels safe, familiar, and deeply peaceful. For even when words begin to fade, the enduring power of love and comfort can still be deeply felt. Let us now move on to the fourth sign, frequent infections and slow healing. As the body begins its natural process of winding down, one of the most obvious physical manifestations is a noticeable weakening of the immune system. You may notice that someone who rarely got sick before now seems to catch every passing cold, every bout of the flu, every minor infection that comes around. What were once considered minor illnesses now take much longer to recover from. And even simple wounds, such as a small cut or bruise, heal much more slowly. These changes are not random occurrences, they are indicative of the body's inability to effectively defend or repair itself as it once did. One of the major concerns during this stage is the recurrence of infections. Conditions such as pneumonia, urinary tract infections (UTIs), skin infections, and even oral infections become more common as the immune system's defenses weaken. Many families initially attribute these to isolated episodes of illness. However, when these infections become frequent or take a long time to resolve, it is often a clear sign that the body is losing its natural ability to fight off pathogens. Even antibiotics that once proved effective may seem less effective. The individual may require stronger medications, longer recovery periods, or multiple courses of treatment for infections that were previously considered minor and easily managed. This occurs because as circulation slows and overall organ function declines, the body simply does not respond to medical treatments as effectively as it once did. Another problem that is often overlooked is the presence of chronic wounds. If you notice that small scratches, sores, or bruises do not heal properly or tend to reopen repeatedly, it could be a sign of poor circulation. Poor circulation means that essential oxygen and nutrients are not reaching the skin and underlying tissues efficiently, significantly slowing the healing process. Pressure ulcers, especially in people with limited mobility, become a serious and escalating risk and can lead to dangerous and systemic infections if not carefully managed. Of particular concern is that infections in the last year of life often do not present in the way we typically expect. Instead of a high fever, an elderly person may simply appear more tired than usual, exhibit increased confusion, or show a decreased interest in eating. In fact, in seniors, a sudden decline in mental alertness is often the first and most subtle warning sign of an underlying infection, often preceding the appearance of other more typical symptoms. For this reason, recognizing these early changes can make a profound difference in the level of comfort and support they receive during their final stage of life. For families, watching a loved one endure repeated infections can be both frustrating and deeply heartbreaking. There is a natural tendency to push for aggressive medical treatments, hoping that one more round of antibiotics or one more hospital stay will finally solve the problem. However, at a certain point in this natural decline, the focus often needs to shift from trying to cure to providing comfort, ensuring adequate hydration, maintaining skin integrity through cleanliness and moisturization, and minimizing any unnecessary stress on the body. These supportive measures can often do more for their overall well-being than another course of medication, which may only prolong the suffering without addressing the underlying physiological changes. If you are still watching this video and find these insights valuable, please acknowledge your presence by commenting number 4 below. And if you haven't already subscribed, I highly recommend you do so and turn on the notification bell so you don't miss future videos. With your support, we can continue to create helpful content to inform and inspire you. Now, let's move on to the 5th and final sign, major changes in breathing or circulation. One of the most telling indicators that the body is preparing for its final stage is the appearance of noticeable changes in breathing patterns and circulatory function. You may notice your loved one breathing more slowly or with shallower breaths than before. They may sometimes pause between breaths, or their breathing pattern may become irregular, speeding up and slowing down unexpectedly. Some people experience a specific, gentle, rhythmic breathing pattern known as Cheyne-Stokes respiration, in which breathing alternates between periods of deep, rapid breaths and longer pauses. These changes can be subtle at first, but over time they tend to become more pronounced and occur more frequently. Another common sign is evidence of poor circulation. You may notice that your hands, feet, or even your nose and ears begin to feel consistently cold to the touch. The skin may appear pale, bluish, or mottled, especially around the fingers and toes. This occurs because the body prioritizes blood flow to vital internal organs, resulting in reduced circulation to the extremities. This is a clear physiological indication that the heart is no longer pumping blood as strongly and efficiently as it once did. Some people also experience increasing shortness of breath, even with minimal physical exertion. Simply sitting up, engaging in conversation, or changing their position in bed may cause them to feel winded or out of breath. You may notice them breathing through their mouth more often, or they may suddenly need to stop and catch their breath while talking. If they used to be able to walk across a room with ease, but now have trouble doing so, their lung function may be declining. In some cases, the buildup of fluid in the lungs can make breathing difficulties worse. This can manifest itself as a persistent cough, gurgling sounds when breathing, or even a noticeable tightness in the chest. Many people may initially assume that this is simply congestion from a cold, but in older people nearing the end of their lives, it is often a sign that the lungs are gradually weakening and losing their capacity. This fluid buildup can also make lying flat in bed increasingly uncomfortable, and they may express a preference for sleeping supported on multiple pillows or in a recliner to ease their breathing. For family members, witnessing these changes in breathing and circulation can be understandably frightening and concerning. It is a natural instinct to want to help, encourage them to take deeper breaths, or worry that a medical emergency is developing. In many cases, however, these changes are simply the body's natural and gentle way of gradually slowing down its essential functions. While there may not always be medical interventions that can reverse these changes, there are certainly ways to improve your comfort. Keeping the room pleasantly cool, using a humidifier to add moisture to the air, and offering small sips of water can help ease discomfort. In some situations, medications or supplemental oxygen therapy can provide some relief. But the focus often shifts to maximizing comfort rather than trying to aggressively correct a problem that is a natural part of the end-of-life process. If you notice these signs, changes in breathing patterns, persistently cold hands and feet, or a bluish discoloration of the skin, pay close attention. These are often significant indicators that the body is conserving its remaining energy and that the circulatory system is slowing down. This is a time to be fully present with your loved one, to offer constant reassurance of your care and support, and to create a peaceful and calming environment where they feel safe, secure, and completely at ease. In these final months or weeks, the most profound gift you can offer them is not aggressive medical intervention, but rather unwavering comfort, the preservation of their dignity, and the profound knowledge that they are not alone in this final stage of their journey. Final thoughts. As we come to the end of this video, please take a moment to reflect on the important information we have discussed. Significant and unintentional weight loss, persistent and overwhelming fatigue, increasing cognitive confusion or emotional withdrawal, frequent and recurring infections coupled with slow wound healing, and major changes in breathing patterns and circulatory function. These 5 key signs often manifest in the year before an elder's death. It is important to remember that these signs may not all occur at the same time, and they may not always be obvious in the early stages. However, when you begin to notice a confluence of these changes, it is a significant indication that the body is gently preparing for its final transition. For many families, witnessing these changes in a loved one can be emotionally challenging and difficult to fully accept. It is a natural human reaction to want to fight these signs of decline, to encourage a loved one to eat more, to exercise more, or simply to push through the profound exhaustion. However, there are times when the most compassionate and loving response is to truly listen to the messages the body is sending, rather than focusing solely on trying to reverse what is often an inevitable natural process. We can instead direct our energies toward making their remaining time as peaceful, comfortable, and filled with meaningful connection as possible. Understanding these significant signs is not about fearing death or dwelling on the negative aspects of the end of life. Rather, it is about fostering a sense of preparedness. By recognizing these changes early, you will be able to provide better and more appropriate care, make important practical and emotional decisions proactively, and ultimately ensure that your loved one's final months are filled with profound love, unwavering dignity, and a deep sense of peace. This is a time to cherish precious moments, share stories and memories, and ensure that they know without a doubt that they are deeply valued and never alone. If you notice these signs in someone you love, please take a deep breath and remember that you are not alone on this journey. Many families have walked this path before, and while it is never easy, knowing what to expect can empower you to find strength, patience, and a sense of peace in the midst of the challenges. Thank you for joining us today to explore this important and often difficult topic. We would love to hear from you and learn from your experiences. Please leave a comment below and share one thing you have learned from this discussion and how you plan to apply it to your own life or the life of a loved one. Your thoughts and experiences are invaluable to us, so please do not hesitate to share them. Reading your feedback motivates and encourages us. If you found this information enlightening and helpful, please consider liking this video, subscribing to our channel, and sharing it with others who might benefit from this knowledge. Your support plays a vital role in enabling us to continue creating valuable content to inform and inspire you. Thank you for watching, and we look forward to connecting with you in our next video.